Brooke and Maddie, EMT. Okay, we already got the competitor instructions.
Would you pause it?
Should I pause what?
Never.
Okay. Okay. What precautions must be practiced when treating a patient with severe bleeding? Our answer is apply pressure to the wound, and if there is, apply bandage. What is the primary step in providing care to control bleeding from an open wound? Our answer is grab a sterile bandage and apply pressure with the palm of your hand to stop bleeding. What are the 3 effective ways to control bleeding?
Stop bleeding.
Our answer is stop bleeding.
Clean the cut or wound.
Clean the cut or wound.
And then protect the wound and call a doctor.
Protect the wound and call a doctor. What are 3 early signs of compensated shock?
Tachycardia.
Okay, yeah. Tachycardiac, poor skin color, and cold skin. Was that 4 or 5?
That's 4. No, we're on 5.
Okay. What is the secondary step in providing care to control severe bleeding to an extremity?
Press bandage firmly.
Okay, yeah. Press bandage firmly. An EMT should be prepared to administer oxygen or provide ventilation if an adult's respirations are irregular. Or our answer is irregular. What rate of capillary refill might indicate the patient is experiencing shock?
If it's no longer than 3 seconds.
Our answer is if it's no longer than 3 seconds. The patient complains of pain when you are tightening the tourniquet. What should you do? Our answer is loosen the tourniquet. When the patient is experiencing hypoperfusion, what should be administered?
Fluids or blood products via an
IV. Our answer is administer fluids or blood products through an IV. What should be done immediately after addressing heat loss for patient?
Take them out of the heat.
Take the patient out of the heat.
Our answer is.
Oh yeah, our answer is take patient out of the heat.
Say our answer is.
Okay. What 4 elements must be present when sizing up a situation where a patient has experienced trauma? Weather. Our answer is weather, terrain, bystanders,
position.
And what is it?
Patient's position.
Patient's position. Based upon the calculation, should you identify patient priority and make treatment transport decisions?
My answer is airway. Breathing, circulation.
Our answer is airway, breathing, and circulation.
The ABCs of trauma.
The ABCs of trauma. When performing the secondary assessment, what is the name of the vein checked in the neck? The jugular veins.
No, wait, you skipped number 14.
Oh, okay, hold on. Okay, for number 14, identify the 6 parts of the patient's past medical history.
The chief complaint.
Our answer is the chief complaint.
History of illness.
History of illness.
Past history.
Past history.
Personal or soul cultural history.
Personal or soul cultural history.
And review systems.
And review systems.
And then this is number 15.
And for number 15, when performing the secondary assessment, what is the name of the vein checked in the neck?
Our answer is the jugular.
Our answer is the jugular. When conducting a rapid assessment of the chest of a critical trauma patient, the EMT should evaluate for significant mechanisms of injury and inspect for what condition?
Our answer is inspect airway.
Our answer is inspect airway.
And or center of diatal pulse.
And or center of diatal pulse. When using AVPU for assessing a patient's level of consciousness, A signifies the patient. Alert. Our answer is alert. What 2 steps must be assessed with the patient airway?
Obstruction and protect.
Our answer is obstruction and protect.